My name is Lyndsay Howard. I'm delighted and privileged to be the moderator of this panel on diabetes innovation. Before I introduce our distinguished panelists, I would like to answer a question, which is, I am a geopolitical strategist. I've been a foreign policy analyst and senior advisor to Mayor Bloomberg for a decade at Bloomberg, and was previously a senior advisor to Dr. Henry Kissinger. So what am I doing up here, you might ask? I'd like to tell you, like everyone on this panel, from whom we will hear shortly, I learned about the perils and global crisis of diabetes through others. Despite science and technology breakthroughs, GLP weight loss innovations, and greater understanding worldwide of the power of diet, diabetes numbers are exploding nationally and globally and shattering lives and livelihoods. In my case, 3 people turned my head and attention on the curse and potential cures for diabetes, and the sometimes terrifying consequences of not acting early for lives, livelihoods, and the quality of life for millions of people. Mayor Bloomberg, as many of you know, has been an agent of change for planetary health, but he is also a passionate and fierce advocate for public health and helping humans to live longer, healthier lives as the best way he can improve life on the planet. In 2016, nearly at the same time that he joined the Paris Climate Accords, he also became a World Health Organization global ambassador for non-communicable diseases, an almost unpronounceable word, an acronym, NCDs, namely the diseases that are often invisible killers, like diabetes, cardiovascular disease, cancer, and a few other invisible killers. These NCDs account for 3/4 of the deaths globally. And in fact, we now know that most COVID deaths were caused by underlying conditions of different NCDs, including diabetes. Mayor Bloomberg has, since 2017, partnered with the World Health Organization to build solution sets and awareness, and has used a network some of you may have heard of called the Cities, Global Cities Project. So it's 70 global cities and their mayors who take these issues on and try to communicate them better to the public. So that's a 300 million audience, among others, but it's a small drop in a very large bucket on diabetes. The second person who turned my head was Arianna Huffington, who during a dinner for women CEOs, private dinner, started to tell us about the numbers. This was about 5 years ago. And then she told us some stories, about why she switched from her first business, which she founded at 50, to a second business, which she founded at age 70, called Thrive, about health and wellness, and was prioritizing diabetes. Well, it turns out that there are 150 to 160,000 amputations in the United States alone due to type 2 diabetes. And that number goes up exponentially globally. So this is a bit of a crisis. During the Vietnam War, for perspective, the US service members for the entire war had close to 5,300 amputations, not 160,000. So this is a global crisis. Diabetes is no small thing, and it's no simple matter of shots, insulin pumps, and blood sugar. It is a dangerous disease that can imperil and permanently incapacitate lives. So before I ask tougher questions to my panelists, I'd like to ask each of them to give us a little more background about their journey and how they became involved in efforts to lift the diabetes curse and to find cures. Patricia.
Thank you, Lyndsay. It's a great pleasure and honor having you here. I told you 5 times already, but one more is good too. So the reasons why we're doing the work we're doing in the Silverstein Dream Foundation are deeply personal. Not only my husband and my father-in-law had suffered from asthma for a long period of time, and thanks to an institution in Denver, the National Jewish Health, they were able to get treated and have a normal life. But mostly my younger sister, about 4 years ago, at the age of 27, who was diagnosed at the age of 6 with type 1 diabetes, was suffering all complications at once, including kidney failure. And that moment, the level of awareness rise above myself, and I went into the research of the best doctors and scientists in the country because conventional medicine was not able to save her life. And luckily we found a visionary doctor at the Diabetes Research Institute Foundation who created a treatment that was never done in humans in the US before with mesenchymal cell therapy, a therapeutic treatment that we were able to get FDA approval for an emergency pilot trial. And she received that treatment followed by a double transplant that have saved her life over a period of 3 years undergoing through this condition. Today, almost 3 years later, she's a young woman with 35 years old, full of life, without any of the mentioned conditions, not type 1, no kidney disease, no retinopathy, no neuropathy, and she has a full life in front of her. And that moment, I realized there's so much we can do to prevent these conditions, these complications, these deadly outcomes for young individuals. And if one person was able to be safe with resources and science, how come there are not more solutions for others? And that's the creation of the Silverstein Dream Foundation, a platform that supports diabetes prevention programs because it's a preventable disease with nutrition education protocols and follow-on coaching treatments, and investing in early stage technology companies for diabetes. So this is the reasons why, and in a moment I will tell you where we're heading with this. So I'm going to pass it on to my colleagues here.
Great. Like you, Patricia, everybody here has been touched by diabetes in some personal way. Unfortunately, most of my family was wiped out by cancer and diabetes since a very young age. And what I came to know through the journey of discovering this was that most healthcare technologies don't see the light of day and never come to market. And those that are even less so funded, even more so, don't come to market. So I wanted to become a part of that journey, and that's why I do what I do. And I've been a healthcare investor for about 30 years in 30 different markets, and that's given me the unique perspective of respecting, as some of our previous panelists had said, the ecosystems within, the payors, the policies behind each one of these markets, and then the technologies from early stage to late stage that I've been part of and investing in. And it's given me a unique perspective, and I love what I do because the technologies that we're part of and investing in, if they were around when my family was around, they would still be around. And now our friends and loved ones can be around longer because of the work we do and the companies we invest in.
Thank you. And well, my name is Abbas Hashmi. I was born and raised in Saudi Arabia, and the reason I'm here is because I've seen the pandemic of diabetes destroy families, including my grandfather. I've seen him chugging Coke. He was an engineer, and during the afternoons, he will just take not Diet Coke, regular Coke, and just chug it. And growing up, I thought this is the lifestyle. This is how you grow up, and eventually you have diabetes and you die. And the moment of truth arrived when my really good friend passed away. And during that period, maybe a month or two, I met Patricia, and she was kind enough to give me the platform to talk about it. And because I come from that background, it is just bizarre, the numbers, the lifestyle impact that brings to to the family. So on one side, you have prosperity, money coming in, but on the other hand, you don't have literacy, you're eating differently, your body is not predisposed to that kind of diet, and thus you end up in that situation. So that's important to me. Other than that, I lead the program at Columbia Business School for family businesses and family offices, and I run a small little investment firm in Riyadh and in New York. We invest primarily in real estate, but hopefully now we'll start to look into any technology that is associated with diabetes.
Hi everyone, I'm Dr. Jeff Hawkins, and I have a company called Diabetes Reversal Group, and we have the distinction of having the only patented system in the world that reverses type 2 diabetes. So we've been doing it for 16 years now, and my wife and I started this about 16 years ago because I had an aunt who died of this disease. Her father passed away from diabetes, and 16 years ago when we started this, there was no program somebody could join that showed people exactly what they should eat and not eat, what supplements to take, what exercise to do, and provide coaching and training to hold them accountable to actually reverse this disease. And so we started it, and it's been 16 years. And back in 2020, we were doing a clinic model where we had 17 brick and mortar clinics open with leases signed on 13 more locations, and then COVID hit. And so we were forced to shut all those clinics down because we weren't considered essential, if you can believe that. Liquor stores essential, reversing diabetes not so much. So that basically almost took us out. And so in the midst of that despair of COVID, we got our patent approval. After 3.5 years of waiting, we got patent approval September 2020. And that's why a lot of you have not heard about us, even though we do have the only solution patented in the world to reverse type 2, is because of post-COVID. So now we've converted to a telemedicine company, and we're coming out of that right now. So even though we kind of have a startup feel to us, even though we've been in this space for 16 years now and have the only solution. And so now we've converted to telemedicine. We are expanding rapidly. And this is the first event like this I've ever done where I'm in front of investors, potential partners to help us scale and grow. So I'm looking forward to meeting anybody who wants to talk to me about what we're doing, looking for strategic partnerships, anybody else is interested. And yeah, so this is a personal mission for my wife and I. And our daughter works for our company too, and now it's just a matter of putting gas on the fire and getting this in front of as many diabetics worldwide as we can, because again, this disease is no joke. We saw it firsthand with 2 family members, like other people did, and we have the solution, so it's very exciting. So glad to be here.
Thank you all. Patricia, from your perspective, why is securing dedicated investment for diabetes innovation so critical right now? And how does venture philanthropy play a unique role in advancing solutions that might not otherwise reach the market?
I think it's important to understand the staggering numbers, diabetes worldwide and diabetes nationally, so I'll go over them. Diabetes worldwide, we're talking about over 500 million people living with this disease. The prediction is that in 2045, this number will rise to 780 million, which will mean that 1 in every 8 persons will suffer this disease. Its type 2 prevalence as type 2 is a prevalence on this disease, type 1 is around 9.5 million, having 1.85 on youth, which means that type 1 as a lifelong autoimmune condition can also derive to complications that also increase the medical bill. When we look at the numbers in the US, we're talking about 38 million US citizens living with diabetes and 97 million with prediabetes or misdiagnosed that don't even know it, which is almost half of the population of the US. It's sad to say that it's an opportunity market for investment because when we look at technologies in the early detection, prevention, diagnostics, and preventive care, it is a huge market coming into play by leveraging AI, which is coming very quickly, as you may know. There's a huge demand of consumer, and there's also a huge economic burden. As we know today, $400 billion are dedicated to diabetes cost in the US. Of those, type 1 diabetics is around 25,000 per year, and type 2 between 12 and 20,000. If we can just impact a fraction of this pandemic, we will save billions in healthcare expenditure that we can reverse and direct to other complications and other parts of the disease that is caused. I think it's important for investors to understand the opportunity market we're looking, and philanthropy capital is more important than ever. And I'm talking about from the role I have as a founder, as a president of the Silverstein Dream Foundation. We're a young organization. We're looking to expand greatly, and this is a disease that no one can tackle alone. We need to partner up with high-quality partners to really leverage our networks and really implement the ecosystem with these preventive tools.
Thank you, Patricia, for enlightening us on the possibilities. Everett, given your role structuring the Silverstein Dream Foundation's investment strategy, can you share some insights on how investors and philanthropists can work together to create sustainable funding pathways for diabetes innovation? And do you think the most impactful funding models, what are they? What should we be looking at?
I'm going to speak more to the first part. I mean, philanthropic capital is passionate capital. This is capital that's going to have an impact far beyond just dollars and cents and IRR. It's going to affect people's lives and the lives that are touched by them. So I would say, working with some of the other charities that are working with us in terms of how we structured our, investment strategy, we're working with the top diabetes investors in the world, and then some of the top charitable organizations in the world who are tackling diabetes. And it's a virtuous circle because we're not a typical fund structure, and we're more of I would say, an evergreen fund or patient capital. We have the ability in a non-competitive way to work with our peers. We're not driven by IRR, we're not driven by MOIC or these typical metrics that a fund would have. We're driven by the impact of the companies that we invest in that model. And because of that, we have more of a collaborative approach, and we can draw more capital. And if you want to get technical on it, some of these funds that allocate to companies have particular mandates about how much capital they can allocate per company or per effort. And because we're part of this virtuous cycle and part of that, I'd say, community, we are now a part of that, and we have the ability to support the companies with them, so those companies can therefore get more funding in the process.
Thank you. Jeffrey, your work at the Diabetes Reversal Group, and it is reversal and permanent and patented, focuses on protocols that aim to actually reverse type 2 diabetes. Could you share a little bit about the latest advancements in these treatments and protocols and how you see them fitting into the broader landscape of diabetes innovation and investment?
Yeah, so the biggest thing I want people to know, which most people don't, is that it is reversible. And probably 99% of diabetics don't know that type 2 is reversible. They think it's a curse, and the hope is taken away that they have this disease, they have to take meds the rest of their life, and the best they can do is try and stop complications from happening. So what we've seen, at least in the last 5 years with our company, is that it's just getting the awareness out there and letting more and more people know that it is reversible, because they're not being told this by their physicians in their office. They're told it's a manageable disease, and that's great. And I'll read something, we talked about this earlier. This is another reason why we started our companies, because I looked around and thought, well, there's the American Diabetic Association, there's all these companies that are in the diabetes space, so why is there not more impact? And I looked this up, and the American Diabetic Association started 80 years ago, so 1940, and there's more people getting diagnosed with diabetes now than ever before as far as incidence. And if you look at what their stated objective is, it's the overarching goal is to prevent or delay the onset of diabetes complications, right? So delay the onset of as if it's an inevitable thing, and ensure the best possible quality of life for individuals with diabetes. So nothing in their stated goal says reverse the disease. It's all about managing it. And so that's really why we started this, because we're more action-oriented. My wife and I, let's frickin' do something about this. And people are donating billions of dollars to these nonprofits that aren't making an impact. And that's why we started our own nonprofit too, and we called it the International Diabetes Association. So we have that, and that purpose is funds come in, and that's used directly for patient care to get our program for people that can't afford it. So it's all about helping people get the quality of care they need, and first of all, they're letting them know that it's actually reversible. And we have the solution. So now it's just how do we get this in front of millions of diabetics to make an impact and have them save their life? And that's what it's all about, is having them save their life from a disease that's reversible. And so it's very, very exciting. So.
Abbas, given your deep experience running a family office and your understanding of the macroeconomic and technological landscape in the Middle East, how do you see global capital flows influencing the prioritization of healthcare initiatives like diabetes innovation? And what strategies can we use to channel more funding into these critical health sectors in the region?
Well, absolutely. Good question. So if you look at the data, around 35 million Saudis live in Saudi Arabia. Out of 25% have diabetes. 90 or 95%, depending on how you cut it, have type 2 diabetes. And that is driven by primarily either genetics or lifestyle. Now, from the government point of view, healthcare has been an integral part of the Vision 2030 initiative. And when you look at how Saudi is managing it, they're trying to do it a little bit more aggressively, and I'll tell you what needs to be done as well, and I've been in conversation with 2 people, hopefully they will listen. But from one side, they are trying to early detect it, so setting up early detection centers in malls and in hospitals. Second conversation happens when you're diagnosed, so you rightly said, training the medical staff and healthcare providers to tell people that this is reversible. You can manage that, and you can also reverse it if you follow a regimen. And thirdly, making sure that lifestyle challenges are not there for people who have that. Bigger challenge that I see from an investment point of view is prevalent in every high context culture, where people think, hey, this is not a big deal. If somebody is diagnosed with something, it's not a big deal, because it's a high context culture. Showing any kind of medical challenge is considered to be a weakness, especially highly prevalent amongst men. So when I look at the investment landscape, what really works nowadays is coming with not an extraction mindset, but a collaborative mindset. Gone are the days when people were coming in with suitcase. We used to call them suitcase bankers. They'll land on Monday, get out on Thursday. Gone are those days. Saudi, UAE, Qatar, they're all now thinking about collaborative efforts. How can you bring this technology to us if we invest in you? So having those conversations are important. There are plenty of incentives that are out there from the government. More than happy to talk about that on a one-on-one session. But there's so much happening right now. And as Patricia, you rightly said, it's unfortunate that we have to label it as an investment opportunity, but indeed it is. But it is one of the best impact that you will get if you're not investing in this space. There was a time when I used to think diabetes is part of the overarching healthcare umbrella, and it will be solved on its own. It's not, it hasn't, right? So it has to get its own focus, and I'm grateful for Patricia and Silverstein Dream Foundation to start that dialogue.
Thank you. Everett, can we turn back to you for just a moment? In our different exchanges, you've talked about how where we need to go is to get to the point where it's months prior to detections, to reach better patient outcomes and better results and fewer complications. You said that people don't even realize that it's a closed loop system where they can monitor and manage their diabetes. Can you talk a little bit more about where you see the potential, especially through the Silverstein Dream Foundation, to move from what you call patch instead of a pump in a philanthropic way, but on an investment platform that scales?
Oh, sure. Again, one of the abilities that we have, which is unique, is that we don't have a predefined mandate where we're only focusing on, let's say, therapeutics or devices or digital. And there's advancements in every single one of these areas. So we have, if you want to look at it, you can break it down to 6 particular areas. You can look at that prediction, diagnosis, management, mitigation, treatment, and reversal, such as Jeff is doing. And in every single one of these areas, it's fraught with advancements in technology. If we want to look at the prediction, we could take some of the other panelists were talking about AI. We leverage AI plus multi-omics data, which is anything from genetics, metabolic, clinical data, as well as environmental, and we leverage all of that. We can have actionable insights. Whereas it used to take, somebody would be diagnosed months prior to being, classified as a type 1 or type 2 diabetic. We can now see technologies that are going to be able to predict this years in advance. And what that does is it gives someone the empowerment to, watch themselves have a greater accuracy of prediction so they don't fall into a catastrophic event where they become hospitalized and a burden to the system. If we want to talk numbers and investments, I think Patricia had mentioned that the current population that suffer from diabetes is around 500 million, predicted to go up to 780 million. Take 780 million people globally, and every time there's a catastrophic event, they're hospitalized, it's a cost to the system of about $25,000. 25,000 times $780 million, 780 million people. Save 15% of that. That's a significant amount of money. So that's some of the thesis where there are investments and where we can play and where we have an ability to do things differently because we don't have such a refined mandate. We have more of a patient capital approach. And those are some of the advancements that we're looking into on a daily basis.
Thank you. Patricia, could you speak a little bit more about the power of partnerships and what it means to build global quality partnerships that also connect to the science and the technology and AI to harness all of that for your vision?
I think there was a panelist before at the Female Innovators this morning that actually nailed it when she described how you enter, how you change the culture when you enter a system. It's not only about investments, it's not only about science, it's not only about having the best team, it's about changing the culture of the ecosystem. So integrating these devices, these technologies, they have to be accessible. They don't have to replace people. They have to be useful for doctors and clinicians. You have to find the right payer. You have to minimize the payer outcomes so that you can actually save money for the payer. So you have to be really smart to change the culture. You need friends, you need network ecosystems, you need clinicians, payers, science, investment, you need all of it. And so, as my brother-in-law said before, you gotta take that innovation and run fast before someone else is gonna do it for you. And really, it's not about creating a new device that helps everybody manage diabetes so they don't die. It's about educating the diabetes population. It's about educating diabetes clinician and medical teams. It's about educating investors so they can put more funding into healthcare and don't look at healthcare as a risky and volatile industry, more as there is a part of the healthcare industry that is volatile, that is the therapeutics, and even now more than ever, but we can access and improve the next generation of and reverse the rates of pandemics by investing in health technology and devices and changing these cultures. And this is, it will take time and it will take a lot of effort from a lot of organizations to partner up and to believe in the same mission. So aligning missions with different bigger organizations and the ones who represent the industry is key at this moment, and we all have to be aligned. So what keeps me up at night is thinking about how we can partner up with bigger organizations, more experienced than us, that we can all leverage to each other's network so we can achieve this goal faster.
Thank you. Jeffrey, a question for you. What makes DRG fundamentally different? Can you walk us through a little bit of the clinical data and real-world impact? And you had mentioned in our discussions that you received your patent during COVID, which, like all businesses, slows down scaling and implementation. But why is now the right time to invest and move this science and technology?
Yeah, so our program, when I say that we reverse, I want to make sure everybody's clear on that. Reversing it is not curing type 2 diabetes because there's not a cure for it. Once you have it, but you can reverse it, which means you put it into a dormant or stage or kind of in remission. And so we say when our patients, we get them to have an A1C of 5.9 or lower, taking no diabetic meds. So this is a complete wellness program. They're off of all their meds, including insulin, including GLP-1s, which is just, again, another shortcut medication that people take that's not solving the problem. So that's what we do. And so the impact that that has is, again, the way that we do this, it's saving so much money for corporations because the average privately insured corporation is spending about $15,000 per year per diabetic employee. So they can pay us $4,000 or $5,000, reverse it, do the math. I mean, it's very simple math for them for these self-funded plans. We're also rolling out a licensing program for physicians, chiropractors, dentists, where they can do the program. So then we're also wanting to, again, doing Dr. Phil. One of the benefits of this is he's really good friends with Dr. Oz and RFK Jr. And so help facilitate that meeting, getting this covered by Medicare and Medicaid, because that's why this is huge, because there's 20 million diabetics right now that are on Medicare and Medicaid. And they're averaging spending $14,000 per year per person on Medicare and Medicaid. So that's about $280 billion that are being spent right now. So if we become a covered service by Medicare and Medicaid, again, just 20% of those 20 million doing it, that can save over $60 billion a year right there. So those are the kind of things that we're doing. And we're also expanding into India next year as well, which is very exciting. And we're going to be talking with him about potentially Saudi Arabia and Middle East. And so again, the timing is so perfect because now that there's a solution for this disease, it's again, how do we get this in front of more people so they can get the benefit of it and save their life, which is the whole point, right? The whole point of this is how do we save people's lives with early detection, prevention, et cetera. And now with the solution where when you have it, you can reverse it, man, I mean, there's no end to what we can do with this. So it's very, very exciting. And that's why it's a really great time right now as far as investment, et cetera, because there's so much going on with AI and tech where you get it from start to finish. Early detection, prevention, early treatment, management, and then reversal. It's the whole gamut. And again, diabetes are not going away, but now there's solutions for this with people on this panel, so it's very, very exciting. Can you tell I'm excited?
I'd like to ask each of you just to say a little bit to how are GLP-1 drugs helping or hurting the diabetes situation, because seems to be helping but also masking other problems.
Okay, yeah, so on GLP-1s, again, I've been around long enough now, 35 years. I mean, there's always going to be a new fad drug coming out that's the new whiz-bang, flavor of the day, right? Flavor of the month. And you're all probably old enough to remember back in the 90s, what was the big weight loss drug in the 90s? Fen-phen, right? Everyone's taking Fen-phen, greatest thing since sliced bread, and then it got taken off the market because of the side effects. And the same thing's happening now with GLP-1s. It's overprescribed. There's side effects now being caused, intestinal issues, kidney issues. So it's just another shortcut. Instead of changing your lifestyle to reverse the disease, let's take a drug where I don't have to change anything. I can keep eating all the crap I want and just take a GLP-1 that solves my problem. Well, guess what happens when you stop taking the GLP-1? All the benefits you got go away. And so that was never designed to be a drug to take every day the rest of your life, but that seems to be the way people are using it right now. And so, yeah, it's not as great as everybody thinks. Yes, it can solve a problem temporarily, but it was never something designed to be taken every day forever. So that's why I think it's not all it's sliced up to be. That's all I can say.
No, I mean, I would echo Jeff's thoughts there. I mean, at the end of the day, GLP, most people don't even know what it stands for. It's glucagon-like peptide, which essentially it's like. So it's not actually the glucagon in your system. It's mimicking your body's response and creating a hormone to regulate your blood sugar. So anytime, as you said, you're tricking your system into doing something for off-label purposes, when you get off of that solution, you're going to have other complications. And there are other, I'd say advancements in the technology. Yes, There are, current delivery mechanisms which are taking it once a week. There is perhaps technology that's going to be coming down the pipeline for once a month. And there are, some of the side effects Jeff mentioned, lean body mass preservation, and they're trying to, inhibit the loss of lean body mass with additional hormones as part of the drug payload. But it's not, as you said, this is a solution for diabetics, not weight loss. So that is one of the main issues here.
Thank you. Before we take a couple of questions, I wondered if Abbas and Patricia could speak to the public education and public awareness front. How do we move into that? In the Middle East, 85 million people have diabetes. Here, Patricia, you know chapter and verse and numbers. What do we do about this together?
Sure. Well, this is my favorite topic. If you open your Facebook, Twitter, any LinkedIn feed, you'll see at least 10 companies telling you how to write emails to get investors, right? How do you pitch to people? But I haven't seen a single program where they teach doctors how do you communicate in a way that sits well with the recipient. I'm coming from a background where even doctors will try to minimize the impact of the disease. I lost my dad because of that. His doctor diagnosed him with some cyst and said, it's perfectly okay, don't worry, it's a minor operation. He thought it's literally a day surgery. He came back, passed away because of stage 4 cancer. So figuring out how do you communicate to the audience that is in front of you, it's extremely important. What fits well here in US doesn't fit well in China or in Japan or in Saudi Arabia. So that is the focus that I hope medical system can have. Patricia?
I always think about preventive medicine as a key missing part of our healthcare system. It's a fit for service, it's a fit for billing patients, it's a reactionary service. And I think at this point, when a country spends $4.9 trillion in healthcare, and we are by far the first country where we are decreasing health spend rapidly more than others, meaning we live less and we live sicker than any other countries, and we spend most of our money, which represents 17.6 of the GDP. It's insanely for me to think of this logically, that there are no preventive medicine implemented in healthcare. How come people who have diabetes in their family, people who have cancer in their families, who are not, they've been screened previously, they're not being treated, they're not being prescribed preventive protocols? I cannot understand it. So I think it's a feed for billion system. It's a capitalistic system. It's a model that is proven to be wrong, and it doesn't help the patients, and it's gonna take more than one conference to fix this problem. It's gonna take a lot of conferences worldwide and a lot of bigger institutions to change these systems. But I will say this is one of the things that it's completely missing in public health and public healthcare systems.
No, I was just going to ask, I was going to add that, what we are endeavoring and doing with the companies that we're investing in is ultimately providing democratization of access. We're giving more access and more personalized care by the companies that are tackling these solutions and these problems that, are reaching so many people. And when you do that, you give people hope, and you understand there's a better path forward because of where the technology is taking us. And I don't want to be all doom and gloom, but I'm very positive and very bullish, as some of our previous panels have said there. There is so much in the pipeline now to really be excited about that's going to affect so many people's lives. And we should all be part of that journey. And I hope that as many people that are here and as many people that are around become more aware of what we're trying to do and are part of that journey going forward.
Can we take one or two questions, go over a little bit? Sure. Okay.
That's good. No,
Okay.
I said no one came to say we're
Okay.
over. So.
Okay.
How successful have you found your talks? Oh, yeah, they're done. It's better when no one
successful have you found your program in reversal? What level of the patient's input does it take for them to actually see the results of the reversal of diabetes?
Yeah, hello? Oh.
Hi.
Yeah, as you can imagine, any kind of a lifestyle change program like we have, the whole ball game is compliance, right? It's like, does everybody know if you go to the gym 3 days a week and work out, you're going to get in better shape, right? Okay, but how many people actually do that, right? You got to get your butt in there. Nobody can do the push-ups for you. And with our program, you got to eat the right food, you got to take the supplements, you got to do some exercise, and if you don't do that, you're not going to get success. So our whole thing that we focus on for 16 years is how do we maximize compliance, because we know that's the whole ball game. When people follow our program, they get better. They don't follow it, they don't, right? Just like with exercise, et cetera. So how do we do that? So again, the success rate for people that do it is over 95%. When they follow it as directed, over 95% achieve reversal. But then, okay, what percentage follow it as directed, right? So that's why we're maximizing that. Right now, it's close to 50% of people that start actually achieve the reversal. And again, it's how do we maximize that and get up to 70, up to 80%? You know, so that's really what we're doing. So all the things we have in our program, the steps and everything with now AI is going to be coming into the picture where they can give more instant feedback, some gamification of our app to get, more of those things in there to kind of maximize compliance, because again, that's the whole ball game, so.
Everett, did you want to say something? Okay.
I'm standing between people and watch.
Wonderful. We have a next question.
Hello? On? Okay.
Speak into the top.
This question's for Everett. You mentioned, 6 areas that you guys were interested in, and you spoke a lot about like AI and data. I guess where, in your experience, have you seen AI and data being leveraged in preventing diabetes complications, and what are some of the coolest or more the newest technology you've seen on the market today? Like, what can we look for?
I think some of the other panelists had mentioned some of the technology we're seeing with leveraging ocular technology to detect diabetic retinopathy or even cancer. There's some amazing technologies there. Microneedle solutions, we're seeing like a lot of CGMs and whatnot that are minimally invasive. But on the AI side of things, I think that I think it was the gentleman from Google had mentioned that data is the ability to get the right data. So as we always say in like any kind of model or whatnot, is you crap in, crap out. So the ability to have the right data to leverage it for actionable insights is exceptional. And there's so much fragmented data out there that we're seeing, as I said before, with multi-omic technologies that is leveraging AI. We're seeing them pull in clinical data from, let's say, your GP, your health records, as well as your genetic data, your environmental data, and some of the other data points to leverage all of that for actionable insights within diabetes to either predict when you're of a high probability of becoming diabetic or when you might have a diabetic episode. And think about that in terms of the hours you can't be actionable. Imagine being able to detect things that you would, think about this, you're sleeping, and when something happens, people can't inject their insulin at the right time. AI and predictability can do so while you're sleeping, so you don't have a diabetic episode while you're sleeping, and it could be a catastrophic event sending you to the hospital. So just to give you some analogies, some areas where we've seen some great advancements.
Thanks. Are there other questions? Or shall we close? Let us thank our very distinguished and inspirational panelists who are forging the way forward. Thank you.